I'm Dr. Heidi Smolka. I'm a nurse practitioner with the Adult Outpatient Program.
And I'm Phil McNally, Veteran Service Coordinator for CHR.
Phil, how is post-traumatic stress disorder related to sleep problems?
PTSD is a condition that is characterized by an ongoing heightened state of arousal, followed by a traumatic event. PTSD can develop slowly over time, long after the initial exposure to trauma, and can get progressively worse. The condition is seen more commonly in women, although it can affect anyone. Researchers have found overlapping areas of the brain implicated in PTSD and sleep that leads to nightmares, flashbacks of the trauma, and chronic hyperarousal states. An estimated 7 people out of 100 will experience PTSD during their lifetime, with 9 in 10 people with PTSD experience insomnia.
Sleep problems and PTSD interfere with the brain's ability to process memories and emotions, which can cause a slowing down of the recovery process after a traumatic event. Post-traumatic nightmares are independently associated with daytime distress, anxiety, and impaired functioning. Nightmares often do not fully remit with trauma-focused treatment, although the degree of improvement is larger for nightmares than it is for insomnia in general. With the treatment of sleep problems, we know that there's a corresponding improvement in PTSD symptoms. So Phil, how common are sleep problems in veterans and service members?
Insomnia is reported to occur in 90 to 100% of Vietnam-era veterans with PTSD. Insomnia was also the most commonly reported PTSD symptom in a survey of veterans from Afghanistan and Iraq. An additional consideration is obstructed sleep apnea, or OSA, which has been found to be more common among individuals with PTSD than general population. The connection between OSA and PTSD is not clear, but is believed to be related to the chronic hyperarousal state and or the use of alcohol to cope with insomnia.
Phil, can you tell us what sleep disturbances look like for some service members?
Well, one that comes to mind is a client I had who was living outside, and we got him into a shelter. He would pace all night. His combat experiences would get in the way of his sleep patterns because he was with other people at that time. Heidi, how can we help our clients improve the quality of their sleep?
Well, you've already started helping by learning about how veterans are impacted both by PTSD and sleep-related disorders. Be sure to ask your clients, have you served in the military, and consider asking about their sleep quality. Good sleep hygiene practices can improve sleep quality. This includes keeping a regularly scheduled bedtime and wake time, having a quiet and comfortable sleep space, avoiding caffeine products after 12 noon, and using meditation or a warm bath to help relax prior to sleep. Therapies such as cognitive behavioral therapy, exposure therapy, and relaxation therapy have been helpful to treat post-traumatic stress disorder. Medications such as prazosin have been helpful in reducing the severity and frequency of nightmares and improving sleep quality related to PTSD.